All right. I also have questions that I've gotten through the over the weekend and through the week. I appreciate you guys contacting us and posting your comments as well on my videos, and also coming and see us. For those of you who are out of town or even out of state, we will start with a virtual consultation for you. So if you're in the Houston area and able to come in for your consultation in person, then we will be happy to have you come in. Otherwise, we will start with your virtual consultation. Okay, so A. Jones is starting us off. All right. How long is the surgery? So for the body contouring procedures, it depends on what surgery you're having done. So my signature procedure is to drain this tummy tuck. On average, most patients will be anywhere between 2 to 3 hours, depending on whether or not you have a previous surgery, if you've had some liposuction, if you've got a lot of scar tissue, if you've had C-sections done, things like that. That will affect how long it takes, but it's usually around 2 to 3 hours. And then you go home the same day. Perla, follow up. All right, let's see. Do you operate on high BMI? I'm currently at 40 BMI, still losing weight, but I already have loose skin. Okay, so great question. It depends on where your loose skin is and what type of surgery you want to get done. I've operated on patients who've had high BMIs. And as they continue to lose weight and get ready for other procedures. So it all depends on where you're carrying your weight and what surgeries we need to do. Typically, my BMI cutoff is 35, but like I said, it's on a case-by-case basis. So contact us. Put in your information in the bottom left of the screen. There should be a form. So leave us your information, and we will reach out to you, get you on the books for your consultation, check out what needs to be done, and then we'll see if we can move forward or not. If it's not safe to move forward, we will just wait until you actually continue to lose weight, get closer to your goal, and then we'll be able to move forward. But I'll let you know once I'm able to examine you and see you in person or virtually if you're out of town, out of state, or even out of country. La Bebecita. All right, tummy tuck and fat transfer. A1C is 8.1. Okay, very good. You're close. My A1C cutoff is 7. It has to be 7 or less for us to be able to move forward. 8.1 is still too high, and you're at high risk of wound healing problems and not being able to actually completely heal your wounds. So we definitely want to get that A1C down. So continue to work on it. Talk to your physician, your doctor who's actually managing your diabetes, and make sure that you bring that down to below 7. And we'll be happy to operate and take care of you. Happy Tiger 94. Could you do an umbilical hernia repair at the same time you do a drain this tummy tuck? It is possible. Now, it all depends on how large your umbilical hernia is. So if you're having some symptoms right now and having some problems, I definitely would recommend that you get it repaired immediately with a general surgeon. Typically, they take care of the umbilical hernias. They will probably go through your belly laparoscopically, so making some small incisions with some cameras and be able to actually fix that umbilical hernia. Otherwise, yes, we can fix your umbilical hernia during your tummy tuck as well. Okay, very good questions. Let's see here. Follow-up question by A. Jones. How long are you down? So the recovery for drainless tummy tuck, the recovery is actually fairly quick. Most of my patients are up and walking upright within the first 2 to 3 days. They wean off their pain meds around 3 or 4 days, max 5 days. Usually when they come back to see me about a week after surgery, they're walking upright, they're off their pain meds, they're usually driving themselves into the appointment. And then after that appointment, they start going back to work. So it's a relatively quick recovery. As long as you're having, you don't have any heavy lifting duties at work, and you're doing, like, for example, a desk type of work, remote work, things like that, you should be able to get back to work fairly quickly after the surgery. Thank you. Hey, Laura, how are you? Thank you for joining in. Looking forward to taking care of you. I appreciate you joining us. And it's always a pleasure to see our TikTok community come in, get their procedures, and then also continue to follow us on TikTok and participate and actually help other patients feel comfortable about their surgeries as well. So very happy to be able to take care of you guys. Looking forward to it. A. Jones is asking, how much does tummy tuck a lipo? Please go ahead and contact us. We will be happy to give you an estimate. Linda, my patient coordinator, will answer your questions, guide you through the process, and we'll be able to help you prepare for your consultation and then your surgery. There is a form in the bottom left of the screen, so you're able to leave your information so that we can get back to you. Okay? All right, very nice. Lavinia Kitchen is asking, can you take body fat from the stomach and back and apply it to areas that you want? Yes, you can. So that is called fat transfer. And I do that all the time. So I've had patients who wanted fat transfer in many different areas of their body. Some will have fat transfer to the breasts. They want some augmentation, increase in volume, but they don't necessarily want any breast implants. So we'll do some fat transfer there. Some women will have fat transfer to the hip and butt. That's typically known as the Brazilian butt lift. Other women will have fat transfer done to the face when they've had lost some weight and lost some volume in their face. We will rejuvenate their face with the fat. Some women, I'll go ahead and actually transfer the fat to the back of the hand to rejuvenate the hand and make it less wrinkly, so you can actually not really see the tendons and the veins and signs of aging. And then I have also some other women who actually want to have fat transfer to the labia to actually improve and rejuvenate the look in their genitalia. So definitely we can get fat from all over your body and transfer it to other areas. Digital Charm. Hi, doctor. Can you do a tummy tuck, lipo 360, and fat transfer BBL on one surgery? Yes, we can. I've done it on multiple patients. As long as you're healthy enough to undergo these procedures, we can do all of those. So contact us, and we'll be happy to answer your questions and get you in for your consultation and on the books for your surgery. Julieta is asking approximately how much is the cost of lipo and BBL. Contact us. My patient coordinator, Linda, will be able to give you some estimates about these pricings, and we'll be happy to answer your questions and get you in for your consultation as well. All right. Kathy AJ57 is saying, I had it done on a Thursday, and I was back to work Monday and didn't have 1 ounce of... come on. I need to be able to see the 1 ounce of pain. Fantastic. Everybody heals differently. I've had some patients who've had your experience, and I've had some patients who need a little bit longer time. But like I said, within 5 days, usually they're off their pain meds and back at work. So I'm glad that you were able to get that done and recovered very well. Fantastic. And thanks for sharing your experience. All right, let's see here next. Wonderful. Okay, so Pretty in Black is asking, is there a waiting list on the tummy tuck and liposuction? It all depends on when you want to get it done. I do share the surgical center with 4 other plastic surgeons. So definitely, we have to make sure that we're able to reserve the dates for you. So it depends on which time of the year you want to get it done. Right now, definitely we're able to book within the first couple of weeks. Usually turnaround time, as long as you're healthy, and we can get the medical clearances that we need and the labs and everything's good to go, we should be able to have a quick turnaround time. So just contact us and we'll be happy to get you in for your case. All right. You're very welcome. You're very welcome, everyone. Thank you. Okay, so let's see here. Lavinia Kitchen is asking, what usually happens to patients, or for patients currently on blood thinners who want fat transfer and or lipo? So it all depends on the reason why you're on blood thinners. So we have to investigate that further. Once we've gone through the etiology of those blood thinners, then we can figure out what needs to be done. So we'd have to discuss that further during your consultation to see what is going on, get a full medical history and a physical examination so that we can actually have a better idea and come up with a treatment plan for you. User BK2. Do you do round 2 work from another doctor? I have. I've done multiple revisions for other patients who had surgery elsewhere. So contact us and we'll be happy to see you and develop a treatment plan for you. All right. Do you ever have any discounts going on? Absolutely. Contact us and you'll be able to get the discounts on our current procedures. Susie Alvarado. Looking forward to hearing from you and taking care of you. The form on the bottom left of the screen is available for you to put your name, email, phone number, and then what procedures you're interested in, and then we'll be happy to get you in. We're also running some specials on Thermiva, which is an in-office vaginal rejuvenation procedure. It has no downtime, does not require any anesthesia. Treatment is usually around 30 minutes, and we've got a package of 4 treatments coming in. Usually you do treatments every month, so once a month for 4 treatments to be able to get the maximum effects of the vaginal rejuvenation. So we definitely have a special on that, but also on surgical procedures. So definitely contact us. Kendra, I can afford my procedure now, but you will be my surgeon. Okay, maybe cannot. I'm not sure, but yes. Well, thank you. I'm glad that you have selected me as your surgeon. We do offer financing options for our patients, and the majority of them are actually able to utilize those services to be able to complement their budget and finance their surgery. So we offer patient fi, care credit, Alpheon, and Cherry financing. So definitely give us a call, contact us, and we'll be happy to help you guys move forward with your procedures and your life-changing transformations. Monica, do you use general anesthesia or local for tummy tuck or mommy makeover procedures? I use general anesthesia. So there are certain procedures that I will do under local anesthesia. Those are quite limited because there's only so much anesthetic that we can actually use before we hit the critical level. And after that point, there's some areas where you might not be comfortable at all. And so it doesn't really make it safe for us to be able to do too much surgery under local anesthesia. But for these big procedures, I have you comfortable under general anesthesia, and we're able to take care of you. So for everybody who's asking about pricing, please go ahead and contact us. Put in your information in the bottom left of the screen. We will be able to reach out to you. My patient coordinator has the estimates for these procedures, and she'll be able to answer your questions and get you like a budget. All right. Yes, Kendra, no worries. Looking forward to it. We'll be taking care of you when you're ready. Okay, Lauren is asking, how close to my goal weight should I be for a consultation? Typically, we want you to be anywhere between 10 and 15 pounds of your goal weight. With that being said, you should be able to get a quick turnaround time, maybe within a few weeks, to get your labs done, clearances, and then get you on the schedule. So usually within that time frame, you're able to drop another 5 pounds or so. So that will get you even closer to your goal. But for a consultation, around that. So perfect. All right. Hey, doctor, how are you? I'm doing very well. Thank you for asking. So looking forward to taking care of you guys, okay? Thank you for joining us on the live. Please share the link with your friends. Let them know that we are answering questions. Sierra, hello. Thank you for participating. All right. Let's see here. Okay. Paul is asking, hi, doctor. I have capsular contracture on my implant and it's painful, but I want to have a child. Should I fix my, let me see. I want to see. Should I fix my implant? You could definitely fix the implant before having a child. Absolutely, if it's hurting you and causing you some pain, yes, you can move forward with removing the implants, fixing the contracture before you have children. Yes, absolutely. Like you said, but it's a personal decision. If you want to wait until you have children, if you are able to withstand that discomfort, then you can do that too. Otherwise, don't delay. Come in. We'll see you. We'll be happy to take care of you and get rid of that capsule. All right. Sierra said, I used to weigh 307 pounds. Congratulations on your weight loss. I weigh 188 pounds now and just found out about penniculectomy. Okay, wonderful. So you probably have a lot of loose skin that is bothering you. No matter what type of exercises you do, you won't unfortunately be able to actually get that skin to completely retract. And so definitely removing that overhanging pannus will significantly improve your quality of life. Now, I've had some patients who've come in as long as their BMI is less than 35, and they've come in for a penniculectomy, but they actually qualify for a full tummy tuck. And so if that's what you're interested in, we will be happy to evaluate you and take care of you. I do the drainless technique, which makes your recovery a lot easier. And I see that you're in the Humble area. You're not far at all. I do get a lot of patients coming in from the Humble area. So come in and see us. We'll be happy to take care of you. And thank you for the panda. That's cute. I appreciate that. So we'll be happy to take care of you guys. So Jasmine, Jamelia is asking, how is the BMI calculated? So I have some videos on my TikTok feed and content that actually explain it. It actually shows you how to do it. But a very simple way is just go on a search engine. So typically Google, type in BMI calculator. I usually go to the NIH one. And then you just put in your height and your weight, and you'll hit compute, and it'll pop up your BMI. If your BMI is higher than 35, then you'll want to play with the weight, and then playing with weight to where you get to a BMI of 35. So decrease that weight until you see, oh, my BMI is 35 or 32 or whatever your goal is. Then you'll see how much weight you actually have to lose based on where you are right now. So let me just give you a couple examples. So for example, if you're 5 foot tall, the maximum weight to get you a BMI of 35 will be 179 pounds. If you're 5'4", the maximum weight will be 204 pounds. If you're 5'8", 228 pounds. And if you're 5'10", it will be 240 pounds. So definitely do that. And we'll be happy to see you. So Sierra, again, it all depends on what your height is. You're 188 pounds. As long as you're taller than 5'1", you'll be fine with us proceeding. But definitely give us a call. Put in your information in the bottom left of the screen, and we'll get you in for your consultation and move forward and get you prepared for your procedures. All right. Designer. Okay, interesting way. What is recommended for body contouring after lipo? It all depends on what you present with. If you've got excess skin, you need some type of skin excision procedure. If you have some contour deformities, we may need to do some fat transfer. So it all depends on what you present with. Definitely, whenever I do my lipo 360s for my patients, I'll always have them do lymphatic drainage treatments. So that will really help to decrease the swelling that they have and make them feel much more comfortable and be able to recover faster. You're very welcome, Paolo. Thank you for participating. Our office is in Houston. We're in the River Oaks area. So definitely give us a call. Phone number is 281-724-3138, or just put in your information in the bottom left of the screen, and we will reach out to you and guide you through the process. All right, let's see here. On the run, can you fix a flabby back? Yes, I do what is called a bra line lift, and I have helped many patients actually feel much better in wearing a bathing suit, a dress, and things like that without having that excess sagging skin in their upper back area. So definitely give us a call. put in your information in the bottom left of the screen, and we will get you in for your consultation and take care of you. All right, thank you very much for the gifts, everyone. I appreciate it. So Tay is saying, is body contouring the same as liposuction? Great question. So body contouring is just a generic term. Body contouring could be doing a breast augmentation. That's contouring your body in some shape or form. So it could include liposuction. It could be an actual surgical excision of excess skin. So it could be a tummy tuck. It could be a monsplasty, so repairing the fupa area. It could be a thigh lift. That's also body contouring, just pretty much just contouring, shaping your body. So it includes all of the above: liposuction, fat transfer, tummy tuck, skin excision, arm lift, thigh lift, breast reduction, breast augmentation, fat transfers, like I said, to many areas in the body, as well as a body lift, which actually includes the hip lift, butt lift, and the tummy tuck. And I do all of these procedures drainless tummy tuck. Jasmine Jamil, you're 4'11" in height. So 4'11", you'll probably have to be max weight of probably around 172 pounds, maybe to qualify for a BMI of 35. So if you weigh less than that, then fantastic. We will be able to move forward with you. I've operated on patients who are 4'10", 4'11", so not a problem. All right, H2H. I have seen advertisements from other doctors that they have tummy tucks for plus size women. Yes, so plus size, what is your definition of plus size? A BMI of 35 is my cutoff. That's, to me, qualifies for plus size, but there are multiple ranges. So BMI of 35 is my cutoff. Higher than that, there's a much higher risk of, thank you for the rose there. There's a much higher risk of wound healing problems and surgical complications. So we definitely want to mitigate those, and we're able to control weight loss. So we definitely want to get you into the safe zone. So just be aware of that. And we'll be happy to take care of you, and contact us, and we'll be reaching out to you and getting you all the information that you need. Bonita Jal 81. I want to get a tummy tuck, but I'm super scared. So what other procedures can be done without having a tummy tuck? Well, it all depends on the type of procedures that you need. If you need a tummy tuck, no other procedure is actually going to get anywhere close to a tummy tuck. If you've got loose skin, a large pannus, an overhanging pannus, you've got separation of your muscles, no other procedure other than a tummy tuck is going to give you those results. I've operated on patients who were very anxious, very scared of surgery. I've done body lifts on them, which is the full 360 circumferential tummy tuck. Hip lift, butt lift, and tummy tuck and monsplasty, and they've done extremely well. So contact us, and we'll be happy to work with you so that you feel more comfortable, able to actually move forward with the surgery. If not, then like I said, once you come in and we see you, we can kind of discuss other things. But again, the gold standard is the skin excision through the tummy tuck for anything around your belly area. H2H, is that safe? Is what's safe? I'm not sure what you're referring to. Maybe the tummy tuck, the drainless tummy tuck absolutely is safe, but I'm not sure what specifically you're mentioning about is that safe. So let me know, expand on that, please. Bonita, okay, I just answer that question. Thoughts on body tight. So body tight is a minimally invasive, well, it's still an invasive procedure, or you have to make a cut, do a little bit of liposuction, and then put in some energy in it to try to really tighten the skin. It works on a select few patients. But again, it's trying to get close to the gold standard, which is actually skin excision surgery. So it all depends on how much skin laxity you have. If it's minimal, then body type might actually work. If it's a lot, body type is not really going to get you the same results as surgery. And surgical excision will be the gold standard and give you the best results. All right. Diamond 2012 is asking, do you take care credit? Yes, we do. We have 4 types of financing options that we offer our patients: care credit, patient fi, Alpheon financing, and Cherry. All right, very good. Okay, Zims is saying, what if you're 5'4", but you weigh 200 pounds? At 5'4" and 200 pounds, you are right at that BMI of 35. We can move forward with surgery to do these body contouring procedures. However, it would be in your best interest to lose another 5 or 10 pounds before we actually move forward. But yes, at 5'4", you would qualify in my criteria, as long as you don't have any other medical conditions that would preclude you from actually undergoing a safe general anesthesia. But yes, 5'4", 200 pounds, we can move forward and operate on you. We can do liposuction, we can do breast surgery, we can do arm lift surgery, we can do fat transfer, whichever body contouring procedures you're interested in. So give us a call, contact us, put in your information in the bottom left of the screen there, and we will be happy to take care of you. Thank you very much for the roses, guys. Monica Humphrey, I appreciate Humphrey Newman, I appreciate it. Plus size tummy tuck. Okay, is the plus size tummy tuck safe? So again, like I said, it depends on what you call plus size. I'm not sure what other doctors call plus size. My BMI cutoff is 35. Anything higher than that tends to be, there's a risk profile that you want to look at. The higher your BMI, the higher risk of surgical complications and wound healing problems. So for me, 35 is an acceptable cutoff. I've operated on patients who've had BMIs of 40 and above, but again, it depends on where exactly their excess weight is, what type of surgery we're doing. So, but the general cutoff is 35 for the majority of people. Do you offer chin lipo? And that will actually help to make it safer. But otherwise, anything larger, you're taking a risk of having some wound healing problems, some major wound healing problems, and some surgical complications. Julietta, do you offer chin lipo? Yes, I do chin lipo. Typically, patients will include that with their mommy makeovers. So they will do like, a drainless tummy tuck, some lipo 360s, some chin lipo, and maybe even lipo of the arms as well, or even lipo of the arms and the thighs. Alan Williams, 1345. For a man who is 6'2" and weighs 205 pounds, is that weight okay for the tummy tuck? Yes. For me, if you're 6'2", you weigh 200 pounds, yes, we could definitely move forward to do a tummy tuck for me. And I do the drainless tummy tuck, so that will help with your recovery. It makes it a lot faster and smoother than the traditional tummy tuck with the drains. So give us a call, put in your information in the bottom left of the screen. We'll be happy to take care of you. All right, let's see here. Great questions. Shay Butter is asking, do you work alone with an assistant or another surgeon? So I work alone. I have a first assist / scrub tech. So they help me close the final layer of certain incisions, but otherwise I work alone. I'm the one who does all of the procedures on my patients. Great question. Chris 080. What about 0080? What about only liposuction and no tummy tuck? Yes, you can have liposuction with no tummy tuck. Again, the BMI is still for just liposuction. I will increase the BMI limit. I've done some liposuction on patients who have higher BMIs, like BMI of 38. I've gone even up to a BMI of 40. Again, there's always that higher risk of wound healing problems, complications, and things like that. The other thing is the higher your BMI, the more risk there is, but also we want your results to be long-term. And if your BMI is that high, there are some lifestyle changes that need to happen so that you can actually maintain those results long term. If you don't make those changes to bring the weight down and then get into a healthier lifestyle, you're going to gain weight and then distort those results, and you're not going to have those results long term. Um, so very good, very good. All right. Uh, okay. Let's get to the next procedures here. Do you do procedures on transgender patients? It depends on what types of procedures. Liposuction, some gynecomastia or breast augmentations. It depends on what type of procedures. And I'll be happy to have you come in for your consultation, and we'll see what we can do. Fast horse tails or talus. What is the price for a tummy tuck? So the drainless tummy tuck starts at $11,500, and that includes anesthesia fee, surgeon's fee, facility fees, as well as all your post-op appointments, your garments, and your scar cream. So definitely give us a call, and we'll be happy to get you in for your consultation and get you on the books for your surgery. Pamela Garcia, how do you know if you can have a drainless tummy tuck? So I perform the drainless tummy tuck on everybody. It is based on my technique. So as long as the surgeon knows what they're doing and they can actually do that, I would do that. So I don't use drains. I feel like the drainless tummy tuck is a much better process for your healing and also your recovery. So I do it on all my patients. Everybody that gets a tummy tuck with me will get a drainless tummy tuck. Laura is asking, how long is the surgery for the drainless tummy tuck? So it's usually around 2 to 3 hours. It's a same-day procedure. You'll be able to go home the same day. And the variety or the change in time there depends on the patient's factors. So if you have a lot of excess skin and fat, your separation muscle is very large, you've got a lot of scar tissue, you've had multiple previous surgeries, you open up, dissect, look, and then we see some hernias, we have to fix those. So those are all factors that can actually change that time. And it could be anywhere between, like I said, 2 to 3 hours. But it's the same day procedure. You come in, whoever's taking you to the hospital, not the hospital, to the surgical facility will drop you off. And then usually within a couple of hours later, they'll be contacted. And like I said, 2 to 3 hours of surgery and you'll be done. Natasha, you're very welcome. Thank you. I hope you guys are enjoying this content. I'm happy to answer all your questions. And don't forget to come in for your consultation. So put in your information in the bottom left of the screen, and we will be happy to take care of you. Natasha Wiley, do you do keloid removal? I do. So I've operated on patients who've had keloids before and helped them with that process. All right, let's see here. Okay, wonderful. Jody Living Free. Jody B. Living Free. I'm in Houston. Definitely send up a consultation. Wonderful. Looking forward to it. Come in and see us. We will be happy to take care of you. You're very welcome, Michelle. Glad I could answer your question. Again, like I said, it all depends on what types of procedures you want to get done. Thank you very much for that. And we will be happy to take care of you. Caitlin Nowak, how far out are your consultations right now? Usually we're able to get you in a quick turnaround time. Usually within 2 weeks, we're able to get our patients in. So consultations vary. We're always able to, why won't it allow me to pin the question? Sorry, I can't select the question. Caitlin Nowak. So contact us, and we're typically able to get a quick turnover. For those of you who are out of state, out of town, we will start with a virtual consultation. Oh, finally, I think there was a delay in the response there. 15 seconds later, the comment is pinned. All right, so let's see here. Nan Deigni, do you do anything on varicose veins? I do not. Howdy, partner. Thanks for the hat there. It's rodeo time. Do you do anything on varicose veins? I do not. There are some vascular surgeons or even some other plastic surgeons that will do treatments for varicose veins, but I don't. So I would recommend that you go and seek those out that do that specifically, and they'll be able to take care of that. Okay, so Vilma is saying, how long do I have to use the girdle in the BBL surgery? So for my patients, I'll have you, hey, Rocha, how are you doing? Nice to see you. Thanks for logging in from Brazil. We're international tonight. So how long do I have to use the girdle in the BBL surgery? So I'll tell my patients at a minimum, you want to be in it for about a month. That's really the minimum. I've had patients who will actually wear it and avoid any kind of pressure on the fat grafting sites for about 3 months. But usually that compression garment, actually, you're going to wear it, correction, not 1 month. It's at least 2 months because you're going to be losing that swelling, shaping yourself over that course of time. So ideally, I would prefer for you to wear it for 2 to 3 months. But definitely avoid any pressure for a minimum of 1 month on the butt area or the fat transfer area. All right, let's see here. Mustache, yeah. Let's see. You're very welcome, Julieta. I'm glad you guys are enjoying these little tidbits here and information. Let's see here. What are options other than a brachioplasty? Okay, I'll get to that question. Let's see. Touch by Karen, post-op LMT. What's your insight on post-operative manual lymphatic massage after the procedure? So for the drainage tummy tuck, I don't have my patients get lymphatic drainage treatments. They don't need it. But for anybody who gets lipo 360, liposuction of the thighs, arms, I definitely have them get lymphatic drainage treatments because I find that it really helps to reduce the swelling, improves the recovery process for them. And I definitely will have them get that done. All right. Thank you very much. I appreciate that. Let's see here. Next question. How much is a tummy tuck? Okay, for pricing, please go ahead and contact us. We will be happy to give you some insight on budgeting and preparing for that. Let's see here. H2H, if you find a hernia, does the procedure become medically necessary? It does not, because it's an incidental finding, and so insurance still won't cover it. I don't take insurance. All our patients pay out of pocket. So if I encounter a hernia while I'm operating, I will go ahead and fix it. All right, Vilma, yes, we've answered that question. So 2 to 3 months is when you're going to be wearing that compression garment. So we definitely want you to be continuing to get your body to shape and getting better contouring throughout that healing process. So again, surgery is important, but that's 1 day. And then the post-operative period is extremely important for you to actually shape and heal well also. Peaceful Asylum. What are the options other than brachioplasty? Okay, so it all depends on what you present with. If you have a lot of excess fat, good skin, we can do liposuction. That will help. Liposuction and some Renuvion J-plasma energy-based treatments to help contract that skin. It's not going to give you the full results that you would necessarily get if you did the brachioplasty, so the arm lift with the incision, especially if it goes from the scar, the scar goes from the elbow to the armpit. But that is a very good option if you're a good candidate to avoid that long scar. Other things would be weight loss and arm exercises. So resistance training, lifting weights, those will all help, but there's only so much you can do. Once you've developed that large amount of excess skin, you need some type of skin tightening procedure, which is typically the Renuvion J plasma, which will give you some skin tightening, and then the maximum skin tightening will be the actual surgery with um, surgery, the brachioplasty or the arm lift. Preach, Quita. What factors decide which type of thigh lift a patient receives? Oh, okay, good question. So it's a combination of the excess skin and fat that you have and where it's located. If you have most of that excess skin and fat in your upper thigh, so near your groin area, then I'll keep the incision in the groin and do a crescent incision. If you've got a lot of loose skin, a lot of excess fat that goes not just around the groin area, but also all the way down towards your knees, and you want significant improvements there, then we'll have to extend the incision from the groin all the way down to just before the knee. So that's kind of like what I look at to determine whether or not we need to extend the incision or not. So hopefully that gives you a better idea of what type of thigh lift you will require. Jasmine Jamilia, can filling the hip dips be included in the mommy makeover? Absolutely. I have patients. The mommy makeover is an overall term. It's not a set type of procedure, so it's a catch-all term, kind of like the body contouring. So for my patients, I've had patients come in for their mommy makeovers. They want lipo 360, a drainless tummy tuck, and a breast augmentation with implants. Some others will come in, they'll do lipo 360, fat transfer to the hip dips and butt area with a drainless tummy tuck. Some others will come in and do the drainless tummy tuck and an arm lift. Some others will come and do a drainless tummy tuck, lipo 360, fat transfer to the labia, fat transfer to the breasts. So it all depends on what you present with, and it's usually a combination of a drainless tummy tuck and some other types of procedures that qualify for body contouring. So we can definitely do the filling of the hip dips for your mommy makeover. So put in your information in the bottom left of the screen there. We will be happy to get you in for your consultation and take care of you. Do you do arm surgery? Keisha Carols. Yes, absolutely. I do brachioplasty, which is arm surgery. I do a combination of things. It could be liposuction for those who are candidates for only liposuction. If you've got some excess fat but good skin quality, you don't need the scar. I do the combination of that with the skin excision. If you have lots of excess skin, women will come in and complain of that. Then I would do the surgery where you have the scar that goes along your arm. So yes, I definitely do that. Oh, follow-up question by Alan Williams, 1345. For us men that are in our 40s, do you accept a tummy tuck? Absolutely. So I've done tummy tucks on patients in their, thank you for joining in, 40s, 50s, 60s, and even in their 70s. So as long as you're healthy enough to undergo these procedures, you'll be a candidate for a tummy tuck. Absolutely. So come in and see us, 40s. Like I said, as long as you're healthy enough, there shouldn't be any reason why I can't do a tummy tuck for you. Great questions. Norma G is asking options for vaginal tightening. So good question. So it all depends on what you present with. There are some non-surgical options. So a lot of my patients will come in and I'll do Thermiva treatment. That's in the office. It's a 30-minute treatment, very comfortable. There's no anesthesia, no downtime, no restriction of your activities. And it has multiple benefits. It helps to tighten the area. It helps to increase your collagen and renew your collagen. So it renders that mucosa more supple. It also increases blood flow, increases lubrication and sensation. So there are multiple benefits. It also helps with stress urinary incontinence. So definitely that's one type of vaginal tightening that we can do. But again, it all depends on how much we need. If you have a lot of laxity, then we will go ahead and do the surgical option, which is a vaginoplasty. And sometimes if there's a tear in the perineum, thank you for the hat there, I appreciate it. Which is a tear that can happen if you've given birth, if you've had an episiotomy and they didn't repair it well. There's a tear between the area, the perineum is the area between the vagina and the anus. So we have to fix that to actually be able to close things, improve your hygiene, hopefully minimize any bacterial contamination, decrease any types of discharge or infections that you might be getting, and really help to improve your quality of life. So contact us, come in and see us. We'll be able to discuss the various options that we can do for you based on what you present with. All right, let's see here. You're very welcome. Thank you very much, everybody, for participating. We look forward to taking care of you. Milan, after tummy tuck, when is it okay to lay regular? So it depends on what tummy tuck you've had. If you've had the tummy tuck with the drains, you will have to listen to your surgeon and follow their recommendations as to when you can actually lie down normally. In my hands, when I do the drainless tummy tuck, my patients are actually walking upright within 3 to 5 days, and within a week, they're able to actually lay on their belly, lay normal, lay flat, everything. So the drainless tummy tuck actually helps you to recover a lot faster than if you have drains. So definitely follow the directions of your particular surgeon because they know their technique. They know how the patients recover using their technique. In my case, like I said, with the drainless tummy tuck, you'll be able to lie down regularly very quickly. Norma G is asking, is Renuvion good for the neck and chin area? I've done Renuvion skin tightening on patients after I've done liposuction to their neck and chin. Yes, it is definitely something that we can do. We definitely have to adjust the settings because you definitely don't want to be using the same settings that you will use otherwise in different parts of the body. That's just normal. You just have to adjust. So perfect. Questions. Let's see. Lucy G is saying, do you recommend Renuvion and J Plasma rather than tummy tuck if you don't have children and plan to? That's a good question. It depends on what you present with and what your goals are. If you haven't had children yet, depending on when you plan on having children, you may want to either postpone getting a tummy tuck or move forward with a tummy tuck. That is a personal decision that you have to make, and we can discuss that during your consultation and figure out what is the best treatment course for your particular situation. So, but very good question. Oh, I haven't gone on we've had a very good run of questions tonight, but I did want to address one of the other questions that I've had, and it kind of goes along the lines of this. Somebody asked, if you're going to separate lipo 360 and a tummy tuck, do you recommend having liposuction first or the tummy tuck first? And in my hands, I prefer to do the tummy tuck first. The reason is when you do liposuction, you're going to develop scarring. There's going to be a lot of scarring. So if you know you're going to get a tummy tuck and you want the tummy tuck at some point, it's different with you getting pregnant after because it is going to expand the skin. But say you're not planning on having any children. You get liposuction, right? It's going to develop a lot of scarring in the area where we did the liposuction. And then say, for example, 9 months later or a year later, you come back and you want the tummy tuck done. At that point, that skin is going to be really tough to actually pull down to the extent that we could have if we didn't do liposuction. So I prefer to actually pull everything down nice and tight with the tummy tuck first, and then come back in and do the liposuction. So that's how I stage my procedures. I do the drainless tummy tuck first, let you heal. 6-9 months later, you can come back and we can do the full lipo 360 if you choose to separate those procedures. Tracy Torres is asking, do you do arm lifts? Yes, I do. I do arm lift surgery, and I usually will combine that with liposuction to contour the arm and give you a nice shape. So come in and see us, and we'll be happy to take care of you. If you're out of town or out of state or even out of the country, we will start with a virtual consultation, and we will be able to discuss in detail what treatments will be best for you. If it's a combo of the lipo 360, the liposuction to the arm with the surgical excision of the skin, so the arm lift, or if just liposuction is enough, or maybe a combo of liposuction and some Renuvion J plasma. So there's plenty of different combinations that we can do. It all depends on what you present with and what we get done. So great question by Laura. For surgery to the arms, is it general anesthesia? Yes, I put my patients under general anesthesia to be able to do surgery for the arm lift. I've posted some videos on, I believe on TikTok. I don't think they removed it. I know it's hard to post graphic videos on TikTok. They tend to remove it. So if it's not on TikTok, then it might be on Instagram. But definitely, I posted videos where you can see when I do the surgical excision here, the skin is, it's all of this I remove. So you can see all of the tissues here, the muscles, the blood vessels, the fat. And so it's a pretty big area. And to be able to get you comfortable, for me to actually do that, it's better for you to be asleep. Otherwise, we have to numb all of this area up. And then same for the other arm. And we risk actually hitting that critical level to where you're no longer comfortable. But we can't give you any more local anesthetic because it might be very dangerous to your heart. And we don't want you to die on the table for an arm lift under local anesthesia. So I do all of my arm lifts with you asleep. It's much more comfortable for yourself and myself as well. And I'm able to actually be very aggressive and give you very nice results. Okay. All right. So I am from the Cayman Islands. If I do the tummy tuck with you guys, how long would you recommend to travel back? Okay. So very good question. So most of our patients will stay for about a week. To be able to recover. Usually they'll come back to see me. You'll stay in the area for that first week, and I'll see you during that time. After that first postoperative follow-up, we make sure that everything is healing well. At that point, you're able to actually travel back. So very good question. Contact us, and we will be happy to give you even more information, discuss the logistics. Definitely when we do the consultation, we will start virtually. And we will discuss all of that in greater detail and get you in for your pre-op visit. Usually it's a day or two before your surgery. So you'll fly in, see me the day before your surgery or 2 days before your surgery, get your surgery, and then come back and see me usually within that first week after your surgery, and then fly back. Wonderful. And then I put all of my patients on some blood thinners, and especially for those of you who are from out of town and traveling and flying, I will adjust the length of the blood thinners to be able to accommodate for your return, because we definitely don't want you to develop any blood clots. Monique is asking, do you have drains with the arm lift? Great question. No, I do all of my body contouring procedures without drains. I apply that same philosophy and technique all over the body. So when I do breast lifts, breast reductions, really large breasts, I don't do drains. When I do arm surgery, I don't do drains. When I do the body lift, thighs, I don't do any drains. I do multiple sutures to close everything in and really minimize the space where the fluid could collect. Okay, God Glam is asking, what is the highest BMI in Houston, Texas? For me, the typical BMI cutoff is 35. I've operated on patients who have higher BMIs, but it depends on specifically what type of procedure we're doing and where you carry your weight and all that. So it's on a case-by-case basis, but general rule is 35 BMI is my cutoff. Great. So put in your information in the bottom left of the screen, and we will be happy to reach out to you guys and get you in for your consultation and for your surgery. What are these? Is that flan? If it is, I like flan. All right, let's see here. Last few questions. We're coming up in an hour. We're going to be wrapping up very shortly. Oh, let's see here. Okay. All right. Um, yeah, so we've actually hit quite a few of the questions that I had written down that you guys had asked throughout the last couple of weeks and days. So if there are no more questions, let me see. I think we'll be good. Do you do smart lipo? I think that's a marketing term, but I don't do whatever it is that they call the smart lipo. I think it's like some type of awake liposuction with some type of machine, specific machine that they use. I don't do that. I use the power assisted liposuction cannula, and when I do my liposuctions, and I put my patients to sleep. I've done a few patients where they're awake, but I prefer to do it asleep because I can't be as aggressive and remove as much fat if you're awake. It's just really difficult to get you really nice and comfortable for you to do that. So, all right, let's see here. Do you offer massages or refer? Okay, so we will refer our patients to get massages, and we definitely encourage our patients to get them, especially when they're from out of town or out of state. You're very welcome, Laura. 10 days till the big day. Looking forward to it. I'll be happy to take care of you. Looking forward to it. Thank you for joining us. All right, wonderful, wonderful. Okay, everybody, it's been a pleasure. Thank you very much for joining us tonight. Until next time, I hope to see you guys either virtually for your consultation or in person, and then definitely seeing you for your procedures. Have a good night. God bless you. And until next time, bye bye. All right. Thank you very much, Instagram family. You guys have a wonderful night and God bless you. All right, YouTube. We've had one person. Hello, do you do inner thigh lifts? Wonderful. Yes, I do. There are several types of inner thigh lift. All right, so send us your information, and we will be happy to get you in for your consultation and figure out which surgery is the best. So, like I said, I do the crescent thigh lift, where your the excess skin and fat is mostly in the upper part of your thighs, and so I can actually keep that incision hidden in your groin area. And if you have a lot of excess skin and fat that goes all the way down to your knees, then I will have to extend that incision all the way down, unless you don't want it. So again, it's all based on what your goals are. So we discuss it in detail, and I make sure that I understand what you're wanting to achieve. Some patients don't want that scar going all the way down, so we're limited in what we can do, and they understand that, and they're okay with that. So definitely send us your information, and we will be happy to contact you and get you in for your consultation and for your procedure. Thank you very much for your question. Appreciate that. All right, we do these lives every Tuesday and Thursday, time permitting, usually starting around 7 p.m. Central Standard Time. But find us on social media. We're a lot more active on, especially on TikTok, and our handle is at Deigni Plastic Surgery. So same name as this YouTube channel. So Deigni Plastic Surgery. And there you can actually really just contact us directly, or let me just give you our phone number. It is, you can just text that number. That's my patient coordinator's number, 281 724 3138. There you go. So looking forward to seeing you, Sheena Cattle, and taking care of you, okay? Have a good night, and thank you for joining us.